In dogs that are otherwise well, aside from their heartworm diagnosis, and have maybe only mild clinical signs like the intermittent cough, echocardiography is usually not urgent. Where echocardiography becomes more urgent is when the dog has more severe signs like lethargy, shortness of breath, or even syncope. And patients, similarly, those patients often have some radiographic changes that are indicative of pulmonary hypertension and or right heart dysfunction. So when the radiographs are more obviously abnormal, and especially when the dog has clinical signs, echocardiography is really helpful to help determine are additional therapies needed and help prognose that patient. And so echocardiography is good at evaluating for pulmonary hypertension. And in many cases, the right heart will tell you a story about whether there is significant ongoing pulmonary hypertension, and the right heart will also shows you its function, and you can evaluate if it's becoming dysfunctional. And so again, echocardiography is useful for the assessment of pulmonary hypertension, and in many cases, staging, determining if it's severe or not, and it'll tell you about right heart function. Additional therapies that might come into play after echocardiography and confirmation of severe pulmonary hypertension would be sildenafil to lower pulmonary artery pressures, as well as pimobendan to help support the right heart if it's struggling. And then finally, as I mentioned earlier, you can prognose the patient a little bit better. So how severe is the right heart dysfunction? How severe is the pulmonary hypertension? And those patients often can still go through adulticide therapy, but the echo can help you better understand the prognosis and whether additional therapy might help support them through their adulticide treatment. Finally, the last reason for echocardiography would be investigation of a murmur. Murmurs due to heartworm disease are usually a right-sided murmur, and so this includes disruption of the tricuspid valve with heartworms, or potentially remodeling of the right heart and disruption of the tricuspid valve anatomy due to pulmonary hypertension.